Hi! Our video today is going to be about a cast application for musculoskeletal fractures. You'll see that in the video today, our client sustained a distal radial fracture from a fall she sustained at home. This type of fracture in the forearm usually affects elderly women, ages 70 and above. Evidence-based practice has proven that these women, or elderly women, especially those that live at home, sustain falls that lead to forearm fractures.
Hi, my name is Riley. I'm going to be your nurse today. Can you verify your name and date of birth for me?
My name is Tracy Bennett and I'm 70 years old.
Okay. How are we feeling?
I feel good. My arm really hurts. I sustained a fall at home and I think it's broken.
Okay. So I have your x-ray. The doctor will come in and talk with you in just a little bit. But we have your x-ray and it shows a distal radial fracture. It's a complete fracture. So we're going to be doing a cast today. So we're going to be doing a fiberglass synthetic cast. It should take about 30 minutes to dry and it's going to keep your arm completely immobilized. Casts are more effective than splints because they keep the arm completely immobilized. We're going to wait for the swelling to go down a little bit. I can see that you still have a little bit of swelling. That's going to prevent compartment syndrome, which is an increase in pressure in your tissues, which leads to less circulation in the fingers and the hands. So once we get that cast on for you, it will be on for about 6 to 8 weeks. That's typically how long it takes for a fracture to heal. Okay. We'll talk about that a little bit more when I come back after the procedure. All right, I see you have your cast on. How is that arm feeling?
It feels good. Definitely feels like it's not going anywhere and I definitely can't move my arm, but I can still move my fingers, so I'm
perfect. No tingling or loss of sensation in the hands?
Nope.
Good.
So my question is just like, how do I care for this and when do I come back?
So a few things. Never stick any foreign objects down in that cast that can cause skin breakdown and irritation. We don't want that to happen. So if you do have any itching or irritation, you can actually take a hair dryer and blow cool air down your cast, and that should alleviate some of that itching. If you have any major pain or irritation, definitely call your doctor. Okay. When showering, the cast is water resistant, but you can put a plastic bag over that cast just to prevent major moisture getting in there. Do you have any more questions?
And I just come back in the 6 to 8 weeks, or?
Yeah, so in about 6 to 8 weeks, you can make an appointment with your doctor. You could do that now, or you could do it in a little bit. But you'll come back, they'll check to see how that fracture's healed, and then we'll try to get that cast off for you as soon as possible.
Oh, thank you.
You're welcome.
Thank you.
So I know I answered a bunch of your questions, but I do have this handout for you. I'm going to go ahead and just get that printed out for you. You can take it home. It has information on taking care of your cast, any tips, and some information about calling your doctor if any of the pain worsens or more swelling occurs, okay?
Okay. Thank you. In regards to the significance in our findings when it comes to cast applications for elderly women plus, it is imperative for them to know that they need to reduce the risk of falls in this type of demographic by simply maybe living in an assisted facility, making sure that if they need to get somewhere, it's not dimly lit, it has adequate lighting, there's no rugs, no loose cords, and making sure that just by doing those things can drastically reduce the risk of falls, therefore reducing the risk of fractures in this demographic that we've seen.
Yeah, and I think too, as women age, their bone density decreases, so making sure we keep up with calcium, preventing osteoporosis, anything like that is really important too, to keep the bone strong and prevent any fractures.
Yeah.